Hey, everybody. Appreciate a little bit of your time today. I think our Lieutenant Governor was going to kick it off if Commissioner, you're ready. Yep.
I am ready. Lieutenant Governor Coleman, are you on?
I am here. I am here. First of all, I want to thank all of you for joining us today. We thought it was really important to reconvene and touch base with everybody again, given where we are. So, first, I want to say what I always say about our schools, which is if there was any group of people that we trusted to develop and implement plans with fidelity to keep our kids safe, it is our schools. And we have seen the success across the state that you have had from implementing all of the guidelines from the Department of Public Health. And as a result, I'm going to knock on wood when I say this, we have not seen any major outbreaks in schools yet. I know all of you probably have at least students or a few teachers quarantined out of an abundance of caution. But the work that you've done has been remarkable, and the work that our teachers have done has been remarkable as well. Everything from completely sanitizing desks after every class to checking temperatures to all of the things, the masks and everything. We just want to let you know how proud we are of the work that our schools have done and the success that you've had. Now we want to keep that success going, and we certainly don't want to move backwards based on what we know now. So as all of you have seen, our country, the world, our state, your county, are seeing a pretty significant rise in cases. And it's not just us. I mean, again, there are other countries that you see reports of closing down altogether at this point, and we're trying to keep an eye on the numbers and continue the reporting and have the same expectations of communities that we have of our schools. And so, given that, I'm going to go ahead and turn it over to Governor Beshear so he can talk a little bit more about basically the community input that we need and the community work that we need to go into stopping this virus. And it's very similar to what you've been doing all along. So I'll turn it over to the governor.
Thanks, Lieutenant Governor. And just like Jacqueline had said, thank you so much for your hard work. I know you care about your students. I know you care about your faculty. And I know you are working as hard as you can each and every day to keep them safe. And I will tell you, as a group, you all are doing better than just about any other group of people that are out there, though none of us are surprised by that at all. Unfortunately, the rest of the country and the Commonwealth are not moving in the right direction. Today, the federal administration suggested that they would pass 100,000 cases a day in our country, 100,000 a day in the next 2 weeks. And I fully expect that we will pass 2,000 cases a day during that same period of time. And our challenge is that's really overwhelming. It's overwhelming of the resources that are out there, but when it is in your community, it's overwhelming and will overwhelm, if we don't get a hold of it, all the good work that you're doing. Just like the strong work we put into the long-term care facilities, where we've got great standards in place. What we know is when a community spread just gets so high, it's impossible to keep it out of places. And I want to acknowledge that your hard work, in many ways, these last months, you were going it alone in what we were asking when a county turned red. And when a county turns red, again, we're not seeing it turn red because of the school. And so our goal was to get a whole community team on board working with you, that when a county goes red, the entire community is doing everything it takes, especially in that first week, to tamp down cases. And to be able to work in coordination with you, with your sacrifice, with the sacrifice and teachers are making. And that's where our Red County recommendations come in. Our goal is to have business, government, the entire community acting on the exact same calendar and structure that you all are. Because if you make that right decision when a county turns red to go virtual for that next week, we want to have the biggest impact in your community to get out of the red and to get the kids back, to give you that additional flexibility to decide how that in-person goes for the weeks that come afterwards. We also wanted to make sure that if you're asking students to learn virtually during a period of time, that we are encouraging businesses to have their parents work virtually too, to try to address some of the very difficult choices in childcare and situations that we are seeing. And so I hope you see what we have put out as an alignment of what we are asking and even expecting, and it's difficult times and difficult decisions of y'all, also with the communities in which you're in, because we know from even the PRISM circumstance where we can cut off all visitation, that if a community spread gets so high, it's just a matter of time. So what I'd ask of each of you is to coordinate, but also encourage that community response. And if we can have that extra push from y'all that you're doing your part, and we need, whether it's county, city government, the business community to do theirs, to tamp down those new cases as quickly as we can, I believe that we can more effectively on a community level battle this virus, and all do it together all at the same time. The other thing it does is, hopefully for those that haven't been willing to follow the guidance that we know we have to, and that you all implement in your schools every day, it takes it from being someone that their actions might hurt, having them never seen, to their neighbor and their local community, people they know and people they care about. And so our goal in trying to increase compliance, which helps all of it, is to make this as personal inside a community as possible. You all are some of the most foremost leaders in those communities. And so I'd ask that you all encourage others to embrace this. I think it will make, well, not that any of our jobs are easy right now, but getting everybody on the same page will hopefully get us in a better place. And we've got to do something different, because the direction and the trajectory, the rate of increase is so highly concerning, and not just happening in cases, but in hospitalizations and ICUs, and we're seeing it on the back end in deaths too. So let me turn it over, if I can, from there, after saying once again, thank you. You're doing a really good job. Trust me, I know decisions, especially if you have to move to virtual after being in. I know those are difficult. I've had to make a lot of those calls myself, but I think we're going to look back on these positions that we held. And while we'll have served a number of years and done a lot of things, making the tough call, but the right call during the most difficult times is I think how we're going to judge ourselves when we look in the mirror, and y'all are passing. I can't tell you how grateful I am. So I think I'm kicking it over to Dr. Stack, and then Commissioner Glass. By the way, Governor. Commissioner Glass is doing such a good job. I got the same haircut.
Thank you, Governor, Lieutenant Governor. So did I.
I wasn't going for your haircut, Steve.
Commissioner Glass. Tony, do you have my slides? I'm going to be real fast through these, folks. I just want to give a situational update, and then echo a few messages from the governor and lieutenant governor, and add a few different ones. So if we could jump to the next one, please. This is the entire journey we've been on from the beginning of March to the present. If you look to the left, you can see when we had the initial, it doesn't look like a surge now, it looks like a little pebble on the road when we went 4, 16, 84, 335, but that's exponential growth, and that's why we had good reason to be fearful in the spring. We plateaued that for 3 months. That was an incredible success because a lot of other states got hit during that period. We then started another climb where it was beginning to look exponential, 1482, 1675, 3882, 3772. That was in the middle of July. And then look at that, we plateaued again for a couple months, 2.5 months. That was another success. It's not easy to interrupt an exponential climb of an easily spread disease like this, but we did it, and we didn't just do it once, we did it twice. What this gave us the opportunity additionally to do was to see how our healthcare system operated, how we were able to handle a disease burden at that level. On the negative side, over that period of time, we had over 1,000 people lose their lives and many other people get sick and have healthcare challenges related to this. But that's the negative side. On the positive side, we managed to not overwhelm our hospitals, managed to resume regular medical care, and managed to reopen all businesses, even though it reduced capacity, and with admittedly many new changes, we managed to reopen the economy. And so that was terrific. But now you see where we are today. And at the end of September, sort of mid-September, we started what looks like it could be the beginning of the base of another climb of a mountain or exponential climb. And we are now breaking records day after day after day. And so this week almost certainly is going to be yet another new weekly high record. This has implications. It's not just taller bars on a sheet. If we could go to the next slide, please. When people get sick with this disease, next slide, thank you, Tony, they go in the hospital. And so there's a lag from the time they get sick to the time they get sick enough to go into the hospital. And so if you look here, it's a little faint on my screen, but late September, so after we started seeing the increase in cases, we started seeing increase in hospitalizations, and that increase is continuing today. Thankfully, the proportion to the number of people testing positive to the number of people going in the hospital is lower now because we're testing so much more aggressively. We're finding the mild cases where people have either very mild symptoms or no symptoms. But this is increasing, and well, I was waiting to speak here. I had a community message to me, their hospital is getting full, and I've been getting occasional ones of those over the last few days. It's going to happen more widely, and so we can expect that we will feel this going forward. Next slide, please, Tony. So I'm going to show 2 slides here to make a point. So this is Louisiana's graph. The solid blue line are surges in cases. Louisiana got hit twice. They are the modern day St. Louis. They got hit the first time, a little bit less so, but they got hit the second time even more so, because you see the peak of the dark blue line is both taller and wider, which means it went higher at its peak and lasted longer over time. The dotted lines are when the deaths started to happen. So you can see on the left, the deaths peaked very high and they went further out to the right. Now the scales are different, so you have to factor that in, but just take the message that there's a delay from the time they get diagnosed with the disease to the time when people die. And so it's probably about a month later when you start to see the significant increase. And then look what happened in the second peak. It went back up again and people started dying again a few weeks later. So this is important because I think what we're showing is repeatedly when the cases surge, consequences escalate. Can we do the next slide, please? Tony, the next slide, please. Thanks. So I can understand how in the state of Kentucky, people might say, well, I don't know anyone who's died, or this isn't real, or this hasn't hit me. Well, there's good reason maybe for some to believe that, because if they don't look at what happens in nearby states and around the country, and they're not attentive to that, or it's just not close enough to home, they may have that experience that it has not impacted me personally. Kentucky, which in most other public health measures is in the bottom 5, in the worst bottom 5 for prevalence of diabetes, hypertension, obesity, cigarette use, substance abuse, any number of different things where we don't want to be. We unfortunately are in the bottom 5 or 10 for public health measures in the United States. We are here in the bottom 5th for mortality adjusted by population. So this is a time when we are in the top quintile, I think you'd call that, right? Top quintile of high performers for protecting people's lives in a state that is in the bottom 5 to 10% for performance on other public health measures. This is no small accomplishment. And when you look at the states that get hit the hardest, and I don't know if these were all the hardest, New York is unfortunately the biggest, but Louisiana, Florida, Texas, where they released restrictions so much earlier and more aggressively, and Louisiana, Florida, and Texas did it in the summer. So they knew what had happened to the other states. They still opened things very quickly, and they demonstrated yet again, when we do this, people get hurt too quickly. And again, I don't mean to insult or offend or impugn these other states. There is no victory here in saying, oh, gee, you made a mistake, or maybe they didn't make a mistake. They made informed decisions and thought they did it right, but this was the consequence of those actions. I think we have the opportunity to learn from that. And in Kentucky, so far, we have managed to do this, I think, about as well as you could, having a controlled release from the dam and gradually escalating and trying to control the consequences and mitigate the worst harms as we went along. If we could do the next slide. But we are facing a real danger now, because and this is not I thought about updating this. This is now, I think this is a day old, so there's a newer map than this. But then I chose not to update it, and I'll tell you why. This changes from day to day, and this is going to lead to some of the messaging I give when I finish these slides. Depending which day you look, this will change. That is the nature of a real-time metric where you're populating it day to day with data. So which day you look at, it determines. Maybe you're red today or you're orange tomorrow. It's not as likely you're going to swing from red to green, but in small counties, real small ones, 7,000, 8,000 population, you could have multi-level skips because one big testing event could shift you more significantly. In the larger counties, that's not likely to happen because you're doing a lot more testing on a regular basis. So we have defined a certain day of the week for people to look at this and use that to inform decisions for the next week. So we've said, look Thursday night at this map, which we have now moved to the very top of our website, and use this on Thursday night to determine the actions you take the following week. That gives people Friday as a work day to make decisions and a weekend to also make accommodations so that they can take action for the next 7 days, Monday through Sunday. We've tried to standardize this for the state. We have used this approach in advising the schools with the metric that we gave you. We use the same approach for the nursing homes, and we have now made recommendations that don't move to the next slide yet, but that are on the next slide for red counties as an entire community. Maybe here's where I'll make these other points. I share the gratitude, respect, and appreciation that the Lieutenant Governor and Governor have shared for the incredible importance of the work you do as superintendents, the work that your teachers, faculty, and other staff do for students. We are indebted to you for helping to raise and educate our young people into responsible adults and citizens so that we can continue to give them the best chance at success in life. So I am sincerely thank you. But I do have to I feel compelled to make some additional observations now. I and Dr. White and others have worked for months now trying to educate and share our information and be as open as we can. In the summer, I was asked to provide a metric so that people could make county level decisions, and I explained that people do not only reside in one county. They go across these lines. These lines on the map are artificial. People skip numerous counties every single day to go to work, to go to hospitals, to see doctors, to go to schools, to do entertainment, to do leisure activities. We do not stay in the confines of a county on a map. And I said that I was concerned that people would have a false confidence that if we gave county level guidance, that they would feel that they only had to do their own county's activities. Nonetheless, as we continue to move forward in this emergency response and try to provide tools and empower local leadership to have the tools they need to make decisions, we moved forward and gave you the single best metric we could find, which is the incidence rate, which is one unique patient or person is counted only one time. So there's no fudge in the numbers. There's no duplication of people or amping it up just to make it look worse. These are unique individuals, and we gave a metric, and we standardized it, and we put it in a standardized location, and we wrapped around it a model that, as I understood it from the West Virginia model, was one people understood, felt was accessible and usable. And I will say, now I am disappointed that we seem to have an increasing number of districts or superintendents who are deciding, now that we have a metric, it's just not the right one, or we'll define a new one, or we'll create one that produces the results we want or need. So we have examples of individuals saying jails aren't part of our community. We don't have to count them. The outbreak is only in the nursing home, so we don't have to include that. I would suppose if there's an outbreak in a factory, that those people who work in the factory can be excluded as well because they're not students in the school. So the more we carve out that every other site and location in our communities don't pertain to our specific one, the more we gut the ability to sustain the success that we have had as a state up till this point. So I am very concerned that people are now just picking the data they want to reach the conclusions they need. I don't say that lightly. We are all under incredible pressure as leaders in our communities and in our areas, in this case, education. We all know the pressure of individuals who are suffering loss for difficulties with employment or loss of jobs. We know individuals who are struggling because their children aren't in school. We know children who are struggling because they're not in school. Right? I could go on for the difficulties for society is facing because of an infection that has run around the world and is shutting down economies across the continents and nations around the world. But I have to implore you to think very carefully before we start carving out more and more and more and more exceptions, because what ends up happening is you end up undermining the effectiveness of any of these public health measures. And what ends up happening is then people are going to find that the infections rise even more and the problem gets more dire. I will tell you, even just in the last 2 days, I have new people in different parts of government who have become infected. I know of a less than 40-year-old whose mother's in the hospital and who is now himself in the hospital with a blood clot in his lung. And the patient that appears to have exposed them was their 2.5-year-old child in the household. I have another instance that she told publicly where my colleague and chief of staff here, her husband, who is only 40 years old, has been out of work for 3 weeks, a firefighter with no medical problems, out of work for 3 weeks and not going back next week. Being out of work for 4 weeks when you're a healthy 40-year-old because you couldn't breathe and had to be hospitalized for multiple days for a condition, this is not the common cold. And I unfortunately think people have come, the fatigue we all feel is translating into decisions that I worry are undermining our likelihood of success. So I don't say this, even though I realize that you've seen me speak enough. I try not, I'm not here to lecture. I don't have a false confidence that I have all the answers. I certainly have a healthy humility for the limitations of what we know. But there are some things we know very clearly, and I am concerned. I'll also share, people have noticed from the county level to the state level to the national level differs. And I would assert that you have probably noticed the same phenomenon in what you know at the school level versus what you hear people say at the state or the federal level. And it varies across those different jurisdictions. This is inevitable. I want to reframe that and say, if you look at a map like the one that's on the screen right now and see all the red and orange everywhere, the message should not be, there's a 4-day lag between when we turned red on the state map and when we turned red or orange on the local map. The bigger message is, oh my God, the whole state is red and orange. We got to get things together and tamp down this disease. And when you look at the numbers on this map, 25 is what it takes to be red. And when there's so much red, people might reach the wrong conclusion, like, oh, well, 25 is too low. Maybe it should be 50 or 75 or 100. Those numbers are set based on CDC and based on what we've seen nationally for when the disease reaches a level we have to be concerned. And if you look at some of these, some counties have numbers as high as 75, 80, 90. So it's very alarmingly high some places. So again, I would urge you to please try hardest to standardize around what we're doing across the state so that we can try to have better success. So Tony, the last slide is my last, the next one is my last one, please. We are asking all communities to do the following things. This is essentially urging people to voluntarily be healthy at home to the fullest extent they possibly can. For workers to work from home and employers to support them to work at home as much as possible, reducing in-person experiences such as shopping and dining out, and to order takeout or delivery to try to support businesses and still enjoy the services and products they provide, to reschedule or postpone large public and private events. I have to tell you as well, we have alarmingly plenty of examples where people go to work, and in the schools, I want to commend you. I mean, people are complying and really working hard sorry, I saw a chat here. People are working very hard to comply with the masks and the spacing and all the other requirements we've asked. And I think you're demonstrating the ability to be successful. So thank you very sincerely. I think everybody's trying things. But we have to work on when the employees leave, encouraging them, they have to be compliant at home. If you have a barbecue with 40 people, that's where these infections really start to take off. So the way we have to keep the schools open is to keep people behaving in all the other settings. So I want to thank you very much. It continues to be a privilege to join you and a privilege to serve. I realize my message was more stern than the governor and lieutenant governor today. But I have to tell you, I am very concerned as the cases escalate, and I have 3 different emails and text messages from 3 different counties alone today with their unique and novel approaches to how they're going to determine whether school should be in session or not, all of which are different from what we have advocated here. I think we are running the real risk of undermining the collective success we've had as a state. And I urge you to reconsider and rally around a common approach for the state to the fullest extent we can. So thank you very much, Commissioner Glass.
Dr. Stagg, I think you had one more slide there on the Halloween.
Oh, yeah, so you can show that, Tony.
Okay.
No. So Halloween's coming up, and obviously this is one of the biggest days of the year for most of your kids and their parents. And we have links that are in the slide deck, but it's on the website too. Halloween guidance for things you can do to do that safely. We'll have Thanksgiving guidance, I anticipate, next week. Thank you very much, Tony, and thanks again, Commissioner Glass.
Thank you, Dr. Stack. Thank you, Lieutenant Governor and Governor, for having this conversation with our superintendents and for being here with us this afternoon. I just want to echo the points that have been made really around commending all of you and all the people working in our schools for the job that you've done in creating safe systems of in-person learning and also keeping learning going for the students that are in remote or in hybrid learning options. I know that's been a Herculean lift over this summer, and it took an incredible amount of planning and effort and execution to get that going. And as has been mentioned, we're seeing success with that. We're not seeing large-scale transmissions happen within schools, which is consistent with what we've seen in other nations and in other places around the country that have stuck to a consistent and principled approach to virus mitigation. With that said, the data that you've heard today should lead us all to understand that we are entering a different phase. And that is a phase that includes exponential growth, where we are seeing more and more cases popping up. That may be due to the weather changing. That's likely what is going on. People are conducting more and more activities inside, but we're seeing this sort of exponential climb in the number of cases around the state. We also are looking at 3 very social holidays coming up in the next couple of months, with Halloween being one. And then we've got Thanksgiving, and then we've got Christmas and the holidays and New Year's coming up. All of those present opportunities for this to accelerate even more. And when we see those kinds of accelerations in cases around the state, it's going to put all the more pressure on the virus mitigation systems that you have in place in your schools. I know that there are lots of conversations happening around the country right now as to how concerned we should be about this. It's hard to believe that people are still having those conversations, but I just looked at the number of deaths that we are seeing nationally, and we're averaging about 1,000 a day now. And that's about like 3 airplanes crashing every single day. And so if you imagine the reaction that we would have from the state or from the country if we crash 3 airliners a day, versus the way people are resisting having a serious conversation about COVID right now, I think that puts things into perspective. Tony, if you could share a screen again, I have a couple of slides I want to work through with folks.
Sure.
So just as we think about this new phase and era that we're going into, we're only really going to be able to know what exactly was the right thing to do, what was the perfect decision in retrospect. So after this is all over, but as we look ahead, I think there are a few things that you need to be taking into account as we enter this new phase and what may be these next few months. First of all, we need to remain vigilant. The increased community transmission is going to on your school mitigation efforts, and we have to keep our guard up. In those places where we've seen breakdowns, where the virus has taken off and we have seen school-based transmissions, are in the same places, Israel and some school systems in the United States, where they relaxed, where they didn't take it seriously, where they didn't keep up the virus mitigation efforts that have been put forth in the state's Safe at School guidance document, or they didn't pay attention to the level of community transmission that was taking place and then act based on that data. So that's point one. Remain vigilant. We've got to stress with the folks that work in our schools that we have to remain vigilant. We can't let our guard down, especially now as the numbers keep climbing. Second, we should expect disruption, and some of you honestly are already experiencing that. We're likely to see increased quarantining due to positive cases or contacts, or we may see school transmissions take place. That's going to pitch schools into remote only, NTI only learning environments. More and more of our counties are getting and staying in the red. That will pitch more schools and districts into remote only, NTI only experiences, and then you'll be able to come back out of that, and then it may take off again. So you should prepare your community for this sort of back and forth that we may see as you try to adjust and adapt to the data that we have and make the best decisions that you can. And then finally, I really think we've got to settle in for the long haul. All through this, going back to the spring, we thought, well, we'll be closed for just a few weeks, or just now we'll close until summer, and then we'll get through summer and we'll come back. And we'll have this figured out, or it'll go away. I mean, there's all kinds of theories about what would happen. And here we still are looking at November, now looking at the election, now looking at the new year, now looking into spring. Here we are still battling this and still fighting this fight. We've got to make sure that our staff, our students, our community, and you as school leaders, you've confronted that brutal reality that we are likely into a long haul engagement, and get everybody ready mentally and with all of the protective equipment and steps you need to take to fight this virus over what may be the next several months. Next slide, please, Tony. Just a few quick updates. You can and should work with your local health department every week check that COVID level, have that conversation in your community about what's the best thing for your community for that next week. The guidance that was put forth in the best practices for Kentucky schools, that guidance is working. It is effective. So make sure that we're still adhering to that. Again, we're vigilant. We're not letting down our guard. Continue to make those efforts to make learning meaningful and engaging for students, even as you have to transition back and forth, and know that we stand ready to assist you going forward. A couple of important dates to remember. Next slide, please, Tony. We will have a webcast in collaboration with the Department of Public Health on Wednesday, November 4th from 2 to 4. It will focus on contact tracing. Again, we may see more cases showing up in communities, so that contact tracing becomes all the more important. So we'll have a webcast that we'll do with Department of Public Health. On that, superintendents are invited to attend, but the primary audience is for school nurses and public health coordinators. And then also the week after that, on November 10th, we'll have our superintendent webcast. We'll be reaching out to superintendents around the state to hear what you want to talk about in that time. We really want to make those webcasts focused on the issues that are of concern to superintendents around the state, and so our agenda will be built on that. Both of those will be live streamed on the KDE portal and accessible to you either during the meeting or after. And with that, Tony, I think we have some time for some questions and conversation. And it looks like Dr. Stack has another point he wants to make, so maybe let's let him answer first, and then Tony, if you could moderate us through some discussion.
Perfect.
Thanks.
Dr. Stack, go ahead.
Thanks, Commissioner Glass. Dr. White asked me to share one of the things we've received as feedback is we talk with the superintendents, but school nurses and a bunch of other people. Let's say here, environmental, I don't know, what does it say? School nurses, district health coordinators, and directors of pupil personnel, people who are important to your work, maybe where our message doesn't get from us at public health to them as clearly as we would like, and as with the chance for questions. So next Wednesday, November 4th, from 2 p.m. to 4 p.m., we are apparently going to discuss contact tracing, immunizations, environmental issues, plastic sheeting, and water fountains. We're going to invite those target audiences, school nurses, district health coordinators, and directors of pupil personnel, and also invited our superintendents, local health department directors, and local health department nurse leaders. So we are going to try to extend our reach and make ourselves as available as we can to answer questions. Thank you.
Okay, great. So superintendents and those that are participating, you should be able to unmute yourselves now. And I believe, Lieutenant Governor, you're going to help us moderate as well. I did have a couple of questions that came in through the Google form ahead of time that were primarily, I don't know if we want to start off with those. Just let me know how you want to proceed.
Yeah, let's do that, Tony. Let's go ahead and take the questions that popped up in the chat first. And then why don't we have folks raise their hands to be recognized? You can then call on those that raise their hands, and we'll allow them to ask their question or make their statement. And Dr. Stack, Lieutenant Governor Coleman, I don't know if the governor is still on, but if he is as well, all of us will do our best to answer those questions or listen.
Okay. All right, great. So the first question that we had was, when you compare the incident rate on the state map with the incident rate that can be calculated using the local health department data with the state COVID daily reports, they rarely match. In the LC by HD data, they would have been red, and then by the state map, there's just a lot of confusion. They're just wondering if they should strictly follow the state map. This is from Lawrence County.
Dr. Stack, looks like you're muted, but I think that's a question for you, sir.
I double muted. I'm sorry. Yeah. So, so this is the point I was trying to make. And look, we are working to try to shorten the data gap as much as we can. I mean, it is a real challenge across 3 layers of government with this many new cases. But here's the thing. Whether you're red at the local level or red at the state level, you will be red at some point. It may be 3 or 4 days later or 5 days earlier or later, one or the other, but you will be red. And if you're orange on our map at the state and red at the local or vice versa, you may be just on the other side of that cutoff. You may be 24 on one number and 27 on the other. And so the end result is similar, I think the benefits of us aligning in a standardized approach and a standardized reference point that everybody can go look at the same map and act accordingly far outweighs any benefit. And I would suggest there's really not any benefit for more tightly aligning those few days. So we're going to work on our data to make it as close as we can, but there will always be challenges. So I urge you, the bigger picture is just to follow the state map so that your local health department can focus on reaching patients, advising them, and working with you in your schools to keep your students and teachers and staff as safe as possible, and focus on that, not incessantly chasing more data points.
Okay. Another question that kind of came in on the data, but I believe that just answered that. And then just a question on why the state just won't mandate following the matrix on transitioning to 100% virtual learning.
Lieutenant Governor, do you want to take that one?
So one of the challenges that we faced in the spring was that, and as we entered into the fall, was a very loud and clear message that you wanted to maintain your local control. And so we worked on the plan, and we worked on the recommendation, and I believe the threshold was set at 6%. And so below that, the recommendations were given. They were based in scientific data from our health experts, and the expectation would be that our school leaders would follow those guidelines based on what those recommendations are. I know there's probably going to be a question about what happens if we get over 6%, because we're creeping up on that. And so I don't know if the governor is still on or not. I don't think he may not be. But that would be a question for him if we get to that point. But it really is an attempt for us to give the best advice that we have and the best recommendations that we have, and still honor the local control up to a certain point of danger in Kentucky, of course, which is why that threshold was set. Dr. Stack, do you want to add anything else to that?
No, I think the Lieutenant Governor, I think you've summarized it. I mean, there's a fine line, and maybe it's not so fine. Maybe it's kind of a broad line. I mean, where people are willing to be told what to do, where people demand to be told what to do, and where people say, I won't do what you're telling me to do. I mean, you're all educators. You deal with this in the classroom and in the school building on a daily basis, right? People want rules right up until you give the rules, and then they don't want the rules. And then even if they want the rules, they say, well, what's the penalty if I don't do it? And then they decide whether that penalty is enough for me to follow it or not. So this is just human behavior. And I think right now we are at that situation where we have been all along, but where we have to balance when do you use mandates, and when do you try to help people understand this is all in our collective best interest. And if we don't do it voluntarily, and if we mandate more stuff, there's plenty of mandates out there already. If you followed the mandates already there, it would avert this problem. We wouldn't be in this situation. The problem is non-compliance, even with mandates. And look, we don't operate, like a police state. So we're not going to chase every individual citizen. We really have to rely on people to pull together and do the right thing. So I think it is a difficult balancing act, and we'll keep trying the best we can. I think the governor has really tried very, very hard and shown great success. And when you see the data I show you, in trying to balance those different tensions, and we'll keep on trying as a team to support the state.
Just a quick addition to that, one of the things that I always ask in anything that we do at the Department of Education or that the state board does is, what is your authority? What are the lines of your authority? Because none of the people that are on this call, if you're a school leader or a state leader, none of us are dictators or kings and queens. We don't get to make up everything that we want to do and impose rules and impose consequences as we see fit. There's a limit to our authority. The statute indicates that during an epidemic, it's the local school board that should be the one that is making the decision about whether or not to close the school. They may have delegated that to you as superintendents, but I believe it is a responsibility that all of you have as we've hit this new phase to bring up this conversation with your community and decide what the best thing is to do for that community.
Okay. Appreciate the three of you. We do have a couple of hands raised. I'm just going to go from the top of my list. Superintendent Polio.
Yeah, thank you. Dr. Stack, if you could clarify, you said a minute or two about this, but we follow the chart pretty closely that you all have provided. And when I get interviewed, a question I've been asked several times is that 25 cases per 100,000, even though we're now at about 35, is only 0.00025%. Could you help me? What would the appropriate answer be to show that that is the proper benchmark to be in red?
Right. So thank you. And that's a really good question. And I think, gosh, I'd have to, if I were to have to give that answer repeatedly, maybe you have now stimulated me to think about how I will, create an answer for that. But so off the cuff, those cut points are ones that the CDC used. And so they're ones where they determined, where they saw apparently that there were cascading problems or difficulties. And so when we are at the levels we are currently at, that corresponds, depending on how you do the metrics, right? It's where you put the decimal points and the commas. You can move it to the left or the right. But those metrics align 25 per 100,000 with a threshold level where people started to see hospitals have problems and you had increase in strain healthcare settings and all. If we get better treatments or the disease becomes more mild over time, who knows? Maybe that threshold could be raised to 30 or 35 or 50, but we're not there yet. And right now, when you see how the hospitalizations are increasing at the level we're at, I think the 25 is still a valid measure. So Superintendent, I guess I would just have to say that the public health experts at the Center for Disease Control have determined those as the threshold levels where we should have escalating concern about the disease and its ease of spreading more rapidly.
Thank you, sir.
Thanks.
Okay. Superintendent Koch.
All right. Thank you, Dr. Stack. Just a really quick question. We've been adhering to the guidance from the State Health Department, specifically RID and a RID zone. And we've been offering targeted services here in Fayette County. And so just checking in to make sure that still is permissible and still a pathway for us to provide those supplemental services to students in accordance with the guidance under the RID zone. That hasn't changed, correct?
Correct, Superintendent Koch. And let me please just emphasize this. We're not in the same place we were in the spring. In the spring, there was so much unknown that we asked everyone, just stay home. Please, everybody stay home. If you need to use your buildings for focus purposes, if you need to use it for targeted audiences who have special needs, if you need to, there's already a pathway for that. Even in the red column on the current KDE, KDPH document, there is a pathway for using your buildings to use small and focused and targeted groups for specific purposes. You should be able to continue to make those choices. And we recognize, and let me just message, you would have my full support as a health commissioner if you are trying to reach certain populations for which you have to do those things, within the band or within the guidelines that KDE has published in in their documents related to this. You would have my full support that you are trying to reasonably balance risk and benefit. But that's not the same thing as a wholesale opening up the school to everybody coming in and coming back to school. So I thank you, Superintendent Koch, for asking that. I mean, yes, we realize you have to make those difficult decisions, and I support you in the need to do that.
Okay. Superintendent Chesser, Fort Thomas.
Good afternoon. And first of all, thank you very much for having this meeting with us and giving us the opportunity to ask questions. And we all certainly agree with you that this is a dangerous virus. It is spreading. No matter what data you look at, we know that that's happening. We certainly agree with that. I guess my question has to do with the correlation between what's happening in schools and accelerating cases or decreasing cases in the community. Currently, and as of course, all of us, none of us had lived through a pandemic before, so we didn't really know exactly what was going to happen. So all of the metrics and dashboards and everything that we all put together in August, they were sort of trials. You know, will this work? Will this actually show what's happening in schools? And I can say, as everyone has said, we've all been pleasantly surprised that we haven't had the spread in schools, that those requirements and guidelines have worked. So for example, in Fort Thomas, out of our 3,000 students, you know, we have 6 positive cases of staff and students right now, 0 quarantines, you know, based on school. All of that's happening outside in social kinds of gatherings. So I guess my question is, and we did turn red today in Campbell County, so we do have to look closely at what we do. The question is, if we did close, what evidence do we have that closing would actually decrease rather than accelerate cases in our community? Because it is different from March. The vast majority of our parents are back to work. Students will be gathering. We're having a problem with that, you know, now with fake homecomings and parents partying and that sort of thing. So closing, we're concerned that closing school will actually cause cases to increase. And so I'm just really interested to see what about closing school will cause the cases to decrease.
And so thank you for that question. And I think you in a very nice and balanced way acknowledged sort of the difficulties here. And look, I keep up as much as I can on the data. You know, I'm aware of the publications where the 57,000 person study that suggested that transmission doesn't happen as commonly in schools. I think here's where I'm hopeful. Over the next 3 to 4 months, we get more clarity. And I realize we want it to be over now, but over the next 3 to 4 months, we should have the first doses of vaccine being available in December. And when we start having vaccine available where we can reach healthcare workers and then ultimately can reach the more vulnerable. And at the very beginning of phase 2, you have school teachers, you know, K through 12 school teachers will be there at the beginning of phase 2. As we do those things, I have to be optimistic because we all have to have a little optimism. This is depressing enough living through a lot of this, that as we enter winter, the heart of winter and early spring next year, that we are now being able to make available to vulnerable populations and essentially frontline workers in key areas a way to try to further mitigate the risk. So that's the first thing, which is not your question. Your question, though, is, so are they worse off at home than they are at school? And are we helping or worsening by shutting, you know, keeping kids out of school? So there are many unknowns, but one thing that's not unknown is that when we bring people together in bigger groups, the transmission occurs. And so I realize when you put them back at home, and I've talked about the dangers of having home parties and gatherings and stuff. So I recognize we don't know what happens in the home, and that's a problem. But I also know that when you bring together hundreds or thousands of people into the school buildings, you're bringing a lot of people from a lot of different homes together, and you increase the risk of potential transmission or spread if they break the protocols, or even if they're just in confined spaces for a long time, because we don't know about the aerosol transmission as much as we need to. And please observe, we have determined in Kentucky, and I convened all the health department directors, so we did a consensus statement. It's the first time I've done that as a commissioner, so that we offered our opinion as an entire public health community. We determined if in your classrooms you are all 6 feet apart and wearing masks, we will not quarantine whole classrooms. All right. And I realize that was a frustration, but we want, if you're all 6 feet apart and people aren't walking around the room, because that's a problem. We have instances where teachers or someone else, teacher's aide, keeps walking through the room the whole time, and that violates what's in the KDE documents. If you are 6 feet apart and wear masks, we won't quarantine the whole room. So I think for right now, at least for the next couple months, in balance, we believe it is better to keep people away from large gatherings of any sort, and that includes schools. Now I have committed that we will continue to reevaluate these things, and if the guidance suggests that we are clearly now in a place where we should be different when we come back after winter break, then we can certainly reconsider these different decisions.
And let me just add, Karen, this is a huge reason that led to the governor and Dr. Stack rolling out the Red County recommendations for the entire community, because we recognize that what you're doing is working for the schools that are doing it right and doing it well to the best of their ability. We're having success, and so in our minds, we want to replicate what's working, but we also want to make sure that the people who are doing the right thing aren't the one paying the price for everyone else. And so this is why with those Red County recommendations, it's a community-wide commitment to helping to mitigate this virus. And so we're hopeful that the business community and parents and any kind of local groups that your students and families are interacting with will do exactly what you're doing, and you'll all be in it together. And with that, I would say, people, fair or not, people have a really, really high expectation for our schools, our teachers, our school leaders, and they look to us as leaders in the community. And whether that's fair or not, it's the reality. And so our hope is that our communities will follow your lead and do the right thing, even when it's the hard thing.
Okay, thank you. Superintendent Wasan in Lee County.
Thank you, Tony. I appreciate that. I just wanted to share with Dr. Stack, especially some other information about the map. And I understand that the map itself is a matrix, and we have to start with something. But if we use that as a total guide here in Lee County, on October the 14th, we got news from our local health department that the cases in our nursing home were rising. And at that day, on October 14th, it was 17 staff and 56 students, and we were still yellow that day. And I made the decision that day to shut down school for the next 2 days and see where we stood. And then we closed down school the next week, even though we were still yellow. And it took us until the middle of the next week to turn red. And so if I would have just based it on the map, I wouldn't have made the decision to close school down for 10 days after that initial impact in our nursing home, which had 17 staff, which I knew in this small community, people work outside the school. So although the map is important, I think that it's still important to think about local decisions and local information, because I was able to prevent, I think, more COVID coming into the schools and more spread, because I was able to give some time to figure out who was connected to that nursing home situation. Some of our staff are married to some of the people that work there. And so it's not just, I think if we just looked at the map, and we would be losing some information too.
If I may, so thank you. I mean, so look, I hope you've heard me repeatedly try to be as straightforward and candid as I can be. And I realize that probably exposes me sometimes, because I mean, everything we say, all of us, is in the public record. But this is difficult and it's complex. What I want more than anyone, I think what we all want more than anything than just blindly following metrics, is we want engaged leaders who are leading their communities and inspiring people to do these difficult things that have to be done to get through this, right? So thank you for what you've done. We also recognize, though, that it's not clear cut, which is why all the way up to orange, we have been permissive and said, here's things you should look at. So you essentially followed Orange County guidance based on the current KDE, KDPH, color-coded metric. You essentially applied Orange County guidance and quite possibly did help the community a great deal in that regard. So thank you. I also want the other superintendents to know, though, too, that I respect the difficulties, and you have to face these different decisions. It is hard to standardize things across a large territory, and the state is a large territory. We respect that. That's why we only did it when we got to the top level of the chart, at the very, very top, where we said, look, you really have to curtail things aggressively at this level. But thank you very much. I appreciate that story, and I appreciate your partnership with the local health departments. I hope you have wonderful partners there. I'm confident that all of you do, and I'm grateful to you for working with them.
We have a great partner in our regional health department, but I think it troubled me more when you said that superintendents are basically that we want to reach the conclusions that we need, and I just feel like it's important to know that we're picking the data that we need to make the best decisions for our kids, and it's not really something that I think that we're trying to intentionally do to reach a particular conclusion, but the local information is really important to us.
Thank you.
Oh, muted, Tony.
Sorry about that. Superintendent Hale, Glasgow.
I don't think I was ready for that. I appreciate
sorry.
you speak. That's fine. And Dr. Stack, I appreciate what you just said about consistency. One of the biggest problems I've had in being an independent district in Barron County is we have chosen religiously to follow the metric, and Barron County has lended itself not to follow the metric and go at times. However, they did call off this time when they had to. But the biggest thing with us is the mixed message it gives in our community. And that's been one of the hardest conversations I have had to have in the community. When you have a large district that chooses not to go, and of course, we're sitting in the city limits and having to go. So it has been a monster on our end, making sure that our community understands the reason we have chosen to do that. So moving forward, any type of consistency or encouragement that you all could provide would be appreciated, I know, by me and several other superintendents in this area.
Let me say one brief thing and then ask the Lieutenant Governor if you had anything you wanted to add to that. It is difficult, and it's difficult to get consistency. And sometimes consistency is good, but right, we can all acknowledge there are other times consistency is frustrating, and that's always a tension in any of these things. I wish we could have consistency of action across all these settings, which is part of the reason why we're trying to align schools with nursing homes, with now the general community, to try to get that critical mass of local leaders on the same page and willing to kind of do this. I think we'll find within a couple of weeks, that whole map will look much better. The whole state map would look better in 2 weeks. It won't be normal, but it'll be much better. In a month after we did it, I mean, everybody will be back to yellows and oranges if we just did this for a month, if we just all pulled together. So I hope we can do that. And the reason I jumped in to speak up also was someone asked in the comments that I can see if we'll be informing mayors and judge executives. And the governor, along with me and others, will now be having weekly calls with the mayors and the judge executives. And we already have KDPH and Kentucky Emergency Management calls, I think on a bi-weekly basis, at least, with judge executives and mayors. So we do try to do this, but as you know, it's difficult to get consistent message. Lieutenant Governor, did you want to correct or add anything to what I said?
I didn't, but it looked like Dr. Glass was getting ready to say something.
No, go right ahead.
All right, go ahead, Tony.
Oh, okay. Sorry. There was another from Superintendent Souders in Casey County that in the chat, just about if will Katie release a statement that we can share, that you all can share, urging our communities to do the right thing. And yes, we can work on that for you. In fact, I'll work on that with Commissioner today when I send you all the email with a video of this email. And the PowerPoint. And again, there'll be some graphics in there. I know that Halloween is going to be an issue for your families. So these are just some tips. I believe I remember talking to Dr. White and Dr. Stack. They'll be doing the same thing for Thanksgiving. So these are all things that we can do to help you as well. Something about are there any consequences for those holding social gatherings over 10 people, for more than 10 people?
These are real challenges. They are. We're not going. we're not going to send armed law enforcement to people's homes and police their backyards. I mean, that's not the United States. That's not where we are. That's not Kentucky. It is very, very difficult. And recognizing that's why it's all the more important for us to get as many people as possible to sincerely appreciate we need to do this and reach a critical mass of people who, through leadership, modeling of necessary behavior, communication, that we try to get the critical mass of people needed to do the right thing, so that we're not going to enter a police state on these things. Unfortunately, the worst extreme would be if the disease really takes off and if hospitals do fill, people will start to feel other kinds of discomfort that don't require government to intervene, and that will drive different behavior. That's what's happened. If you look at these, they call them epidemiology curves, or these graphs that I have shown over time. When the disease reaches certain levels, it appears that it generally peaks in almost every community and then comes back down. That's almost certainly, I think, because people start changing their behavior because they start getting scared. They start seeing people go to the hospitals and lines outside hospitals and people not getting care, and they start having stories about their own family, friends, neighbors who got hurt, and then behavior snaps to for a period of time. I think that is a very painful and costly way in terms of human health and loss of life to learn the lesson. Anyway, that's a long answer to, I don't know what to do about people with gatherings over 10 in their backyard. If they violate a noise ordinance, maybe someone can send someone over, but otherwise, I mean, it's really tough to try to police all of that.
Okay.
Dr. Stack, Lieutenant Governor, thank you for being on with us. We've kept you over on your time, and so I want to honor those that took the time to be with us, and as well as both of you. I know that you got busy days ahead. There were a couple of questions I think we didn't get a chance to get to. Tony, we'll follow up on those and make sure that we have responses to those, that we can work with Dr. Stack and Lieutenant Governor and the Governor's office on making sure that we've answered all of the questions that have come up. Just one last point that I would like to make just as we sign off here. The decision on what to do, or what the best thing to do in terms of the school model, is at the local level. And you've heard that from all three of us on here. But I do think that you raising up when your community gets in the red, when the numbers start accelerating in terms of quarantines, positive cases, hospitalizations, and deaths, when you start holding the conversation about, do you have to close school because of this virus, that in itself is a signal to the community that this is serious, and you need the community's help in controlling the numbers within the community so that school can safely continue. Every one of those cases that's out there potentially presents a threat to the virus mitigation strategies that you have in place. So my last word of encouragement to you is those counties that are in the red, that you're seeing concerning trends in the numbers of quarantines or positive cases that either are connected to your school or not. It's time to start having those conversations with your community, involving the media, involving your parents, so people are aware of the pressure that you're feeling at the school because of this virus. Thanks, everybody. Thanks, Dr. Stack. Thank you, Lieutenant Governor. Thank you, Tony, for moderating. We appreciate everybody being on, and we'll get back to those other questions.